I had been sick for a long time and doctors had no clue what was going on. And I had been doing a ton of research, several years of research on my own. And I found a lot of, singular products, extreme diets, programs that promised quick fixes. Some of it I had tried on its own and it wasn't working. If anything, I was getting worse. So Mary's program, when that popped up in my research, I read more about it. I realized it kind of took a little bit of everything that I had been researching over the years and put it all together. And that's kind of when it hit me that I was like, this is what I need to be doing.
So can you tell us more about what your symptoms were like when you first enrolled in the program?
I could barely sit up. I was too weak. I had come to a place of complete physical disability. At the time that I joined the program, I had just received a handicap placard, which it seemed unreal to me that that's the reality I was facing at that time. To go up and down a set of stairs, either I had to crawl up the stairs, and even crawling, I would need to take a break. I had lost the ability to care for myself independently. So I went from being a really independent, career-driven person to bedridden and getting worse by the day.
When you started noticing improvements, how did that feel? And also, can you share some significant milestones you remember?
The first thing that I started noticing a change in was my mindset, and that I wasn't automatically going to a negative place anymore or a survival thought frame. That was within a week or two that I noticed that change. And then pretty quickly, I started gaining physical strength enough to do individual tasks independently. I started noticing that my migraines were going away. My neuropathy was disappearing. It was little things at first, and then all of a sudden, these big things. Like, I remember very clearly, it was probably only a few months into the program that I made it through my first 24-hour period without having to take Benadryl after I ate. Other milestone moments was driving myself to and from work and going back to my office for the first time.
So when you started out on this journey in our program around a year ago, did you have any idea that you would be in this place you are now a year later?
No. At the time, I would have settled just to not be getting worse. I would have considered that a success. I really would have. But instead of not getting worse, I feel better than I can't even think back to a time in my life that I felt as good as I do now.
Is there any advice you'd want to give to somebody who might be on the fence about joining the program or going through a difficult health situation?
I'd say that, when I entered this program, I was in a place where financially this was quite a decision for me to make. And the way I was able to make the decision that ended up in the long run being a great financial decision was I looked at everything that I had spent money on in the last, let's be honest, 10 years trying to figure out what the heck was going on. I had a lot of medical debt and I was getting no answers and I was getting more sick. So, to make this investment in myself is how I had to look at it. This is an investment into my future. And I can honestly say I've gotten back to work. I have paid down debts that I had just been, struggling to manage for years. The last few months, I haven't had a doctor's appointment. Haven't had one, haven't needed one. If you think about it, with all the specialists you're seeing, and that's at a minimum a $75 copay, never mind what you walk out of there having to purchase for pharmaceuticals or whatever, that is easily for me, at the point that I was at, close to a couple of $1,000s a month, I'm not spending on that stuff.